a very good afternoon to everyone. I hope you have a good lunch just now. My name is Melissa, and topic for today would be, let's put a break on diabetes. I'll be sharing on the basic understanding of diabetes as well as the prevention and management of type 2 diabetes today. Have you ever thought of how is the life of someone living with diabetes as? Do you picture them as having to take pills, and more pills? Or do you think it's possible for them to spend happy and quality time with their loved ones? And the later one on the picture on your right is actually doable and achievable with good lifestyle management. I will share with you in my next few slides on the tips of how to live well with diabetes. We are all in different parts of journey in life, just like this road trip picture here. Particularly for people with diabetes, there are always ups and downs. And if let's say we are going down slope, the conditions is worsening, what can we do? We need to drive carefully, and of course, we need to hit the brakes before it's too late. This can prevent unnecessary hospitalizations. We do have a lot of patients coming back to us telling us that their experience was not very pleasant because they have to go through different surgeries, a lot of blood taking, and things like that. They think that they should actually put more effort prior to the hospitalization incidents. Nevertheless, they are now putting in a lot of effort to prevent their conditions from worsening. So before we move on, let's do a poll. Have you ever done your health screening in the last 1 year? If you have done any form of health screening, you can click on the screen on your screen, yes. And if you have not done any form of health screening, kindly click no. We'll consolidate the results soon, and then we'll be able to find out how many of you actually have done your health screening. You may be thinking, what kind of health screening am I talking about? What about your diabetes screening? Or even your other chronic diseases like your hypertension or even the cholesterol levels, have you gotten it checked? Some of the people may be eligible for certain screening like for mammograms, pap smear, or even other cancer screening as well. All this will be useful to find out whether if there's anything to be treated early. And if you have not done so, I will share with you where can you get it done later on the slides. Maybe you can get ready your pens and paper if you want to take down some notes. If you have any burning questions, you can also put down in the comment section later on. I'll try to answer them one by one. So why do I advocate for health screening? Why is this so important? This one is to help us understand where are we right now in order for us to take action. For example, you are in a jungle, you have no directions, no compass, no GPS, no handphone. What can you do to get out of the jungle? Without directions, we may be turning round and round at the same spot. So with health screening, we are able to navigate throughout the jungle safely and without much hassle. Okay, thank you for your participations. We have the answers in already, and majority of the audiences here says that they have done their health screening in the past 1 year. Well done for those who have done your health screening, and I'm sure that your doctors have already told you what the reports mean. If you have not discuss your report with any healthcare professional, you can actually book an appointment with your family physicians to help them, to ask them what does it mean so that you can understand better. And for those who have not, maybe later on, you still have time, you can book an appointment with the local charge GP clinic to get it checked as well. So what does all this report mean? Particularly, we want to look at diabetes section today. Do you belong to the healthy group? Or you have been told that you have pre-diabetes? Or maybe some of you have been diagnosed with type 1 diabetes, type 2, or even some pregnant mothers have been told that they have gestational diabetes. You may be thinking to yourself, what are all these terms? So let me explain briefly to you what does all this mean. For pre-diabetes, it's a condition where the blood glucose levels are elevated, but it's not high enough to be classified as diabetes. For type 1 diabetes, it is usually discovered at a younger age. And this group of patients, their pancreas is no longer able to produce insulin, therefore they require lifelong insulin therapy. While in Singapore, majority of the diabetes people, they belong to the type 2 diabetes group, about 90% of them. While pregnant mothers, if they undergo the OGTT test during their pregnancy, if their blood glucose level is elevated, they may be told that they have gestational diabetes. And this condition, if not managed well, both the mother and the baby may have some complications during the birth. And these are only some of the common diabetes that you are able to see in the community today. And it is important for us to recognize what are the common risk factors contributing to diabetes, as some are modifiable, which means we can do something about it, while some risk factors we can't change. For example, our age, our ethnicity, our family genes, or even our genes. So if, let's say, those things that we can do about it, we focus more on all these areas. For example, our weight. If, let's say, you are overweight or obese, in Asian context, overweight is BMI above of 23, you can do something to reduce your weight so that you can delay the onset of diabetes. If you lead a sedentary lifestyle or an inactive lifestyle, this may be also one of the risk factors for diabetes as well. If you check your cholesterol levels or your blood pressure and it's on the higher side, it puts us in a great risk as well. So what you can do is you need to put in a bit more effort in delaying the onset. If, let's say, you have been diagnosed with pre-diabetes, gestational diabetes, or even family history of diabetes, you need to be a bit more careful so that this does not develop into a serious conditions. And admittedly, this year 2020 is a challenging year for all of us. And in the midst of fighting against COVID-19, don't forget that in Singapore, we are still fighting against diabetes. And it is a worrying trend. Today, 1 in 3 age 65 and above has diabetes, and there is a 1 in 3 chance you will get diabetes in your lifetime. It is predicted that this trend is going higher and higher. By the year 2050, nearly 1 million Singaporeans could be affected by diabetes. And to win this war, we need to equip ourselves with the right knowledge and the right strategy. And since the majority here belongs to the type 2 diabetes group, I'll be focusing this today. First, to help you understand better what is diabetes, I have a simple illustration here on the screen for you. This happens in healthy people without diabetes. The food that we eat will be digested and eventually it will turn into glucose entering into our bloodstream. And so the blood glucose level will go up. Then our insulin will be secreted by our insulin factory, which is our pancreas. So what does this insulin do? The insulin will act as a key to unlock our body cells to let the glucose in. So the glucose will enter into our body cells from the bloodstreams. Therefore, the blood glucose level will return back to normal. And why do our cells need this glucose for? Our body needs all this glucose so that it will be used as energy. We need energy to do our normal daily activities such as breathing, talking, cooking, walking. All these things requires energy. And our body will regulate and maintain our blood glucose level so that it doesn't go too high or go too low. However, in people with this type 2 diabetes, there may be two main causes. So after they eat the food, the glucose will enter into the bloodstream. However, the body cells become resistant to the insulin, which means that the key does not match the lock. The door or the gateway into the cells cannot be opened up, so the glucose will stay in the bloodstream, and therefore when they check their blood glucose, is be seen as high. And eventually, the cells does not get the glucose and it doesn't have energy. And another situation is when in people with diabetes, their pancreas are not able to produce sufficient amount of insulin to cope with the sugar spikes, which means there is no enough keys to unlock all the doors on the cells. So same thing, without opening the gateway, the glucose cannot enter into the cells and it cannot be used as energy. So when this happens, there will be some signs and symptoms as well. These are some of the common symptoms of diabetes. If you can recall, when you were first diagnosed with diabetes, you may have experienced some of these symptoms. For example, feeling extremely tired or fatigue. You have unexplained weight loss, extreme hunger even after you have been eating quite a bit, frequent urination as well. Some of you may experience increased thirst or slow healing wounds or sores. Some may manifest as numbness or tingling sensations over the hands and the feet. Some may report that they have blurry visions. So all this is our body telling us some warning signs to tell us that, hey, the sugar is high. So do not ignore all these warning signs and get medical attention as early as possible. So for here, I have put up a guideline for us to use to manage our diabetes patient. Do remember that the targets are always individualized. This is just a general guide for your reference purposes. And I've categorized them using traffic light colors, green, yellow, and red. So green zone, which means that the blood glucose is in good control, and yellow zone is that there are something to be done to improve, and red zone is that is on the higher side. So here, as you can see, HbA1c levels is calculated in percentage. This blood test is done in a laboratory setting. And this means that when we test HbA1c, we are looking at the past 3 months average glucose control. So for people with diabetes, we usually target below 7%. And for those who does routine finger prick glucose monitoring, we aim it to be at 4 to 7 millimoles per liter. And if you were to check 2 hours after meal glucose, we aim it to be below 10 millimoles per liter. And as I mentioned, these are all individualized targets. If you're unsure of the target for yourself, you can always check with your healthcare providers. Your doctors or your nurse will be able to explain to you what are the good numbers to have. This is because everyone responds differently and they have different medical conditions. Imagine that an 88-year-old man diagnosed with a stroke or even heart attack or even kidney failure, this person has diabetes. So what should we target for him? Usually we'll allow his sugar levels to be a bit higher than the green zone. This is for safety reason. So therefore, you should discuss it with your doctors to know which one you should aim for. And if let's say the HbA1c is higher than 7% for a prolonged period of time, according to extensive research, the statistics shows that the risk of getting complications will increase as well. Perhaps you have heard of diabetes patients going for hemodialysis or even for leg amputation. So all these are common complications of uncontrolled diabetes. And we divide the complications into two main groups here. One is microvascular, which is the small blood vessels disease, and also macrovascular, the bigger blood vessels disease. And if the damage happens at a smaller blood vessels level, it usually affects the eye, which we call retinopathy, or affects the kidney or the nerves. And 2 in 3 new kidney failure cases are actually found to be diabetes related. If the damage happens at a larger blood vessels at the macrovasculars, usually the organs affected are the brain, the heart, or the peripheral, the veins. And 2 in 5 stroke victims are found to be having diabetes as well. 50% of the heart attack victims actually have diabetes condition. And to prevent all these complications, we can manage it with different things, for example, lifestyle, medications as well. Therefore, prevention is always better than cure. All these undesired complications are mostly preventable with good lifestyle choices. Let's put a break to the downhill slope of diabetes while we still can. We all have the power to make changes and move towards our goal in life. And I believe nobody wish upon themselves to have this condition or to experience any of the complications. And there is no better time to start making changes than now. It's never too late. Maybe what you need now is a little bit of push or more motivation. So you may be asking, how can I motivate myself? And I believe that everybody agrees with me that money is not everything, but money is very important in our life. So you may be asking, how does healthy eating helps me, or even regular exercise help to save money for me? As you can see on your top right corner here, the impact of diabetes on healthcare costs actually is going to be doubled up, increased by twofold by the year 2050. It's a very large amount of money to spend on healthcare. So let's just to share with you, imagine that someone who is having diabetes and experiencing some complications, for example, an infected wound on the leg, this person would require multiple surgeries, admission, or even follow at the clinic. The wound would need regular dressing, and this person may be prescribed a whole long list of medications as well. Perhaps if this patient unfortunately have to undergo extensive amputation, then maybe they need to modify some home environment, get a wheelchair and things like that. So all this is a large sum of money. How much do you think this person would be spending in a year? And compare this with someone with diabetes but with good control of the sugar level without complications. This money can actually be spent on different things that they enjoy and they like. For example, during this festive season, they buy a gift for themselves, maybe a handphone or a microwave or even a new fridge for their home. Or they can spend this money for a staycation in Singapore as well. So don't you think that's a better way of spending your money? Okay. So, if you want to know more in how to manage your diabetes, we can use this acronym here, BEAT. Let's beat diabetes by being aware of our condition, to eat right, adopt an active lifestyle, and to take control of our own health. Not forgetting to stop smoking and also to limit the alcohol intake. The prevention and management of diabetes are quite similar. So we start with the B for be aware. We need to be in the know in order for us to treat. And just now, during the poll, majority have done your health screening already. So well done to you. So that's the first step. You got the first step right. And for those who have not, I urge you to book an appointment to get your health screening done. For those who aged 18 to 39, you can log into this website here displayed on the screen at Health Hub to get the diabetes risk assessment done. It's just a few questions, a short questionnaire to know whether you are in the high risk group or the low risk group. And for those who have done your health screening and the diabetes components found to be normal, and you're 40 years old and above, you can repeat the screening every 3 yearly. So this is for your information. You can get your health screening done under this program called Screen for Life. It's only available at Chas GP Clinic. And if you are a Singapore citizen, you only pay $5 or lesser. If you hold the PG card, Pioneer Generation, you don't need to pay. And if you are under the Merdeka Generation, you pay approximately $2. And if you're holding the orange or blue Chas card, it's also about $2. If you're holding the green Chas card or any other eligible Singaporean citizens, it's about $5. So it's pretty affordable to get yourself checked. And moving on, after you are aware of your condition, what can we do to help us? So the next alphabet would be E, to eat right. What do I mean by eating right? I'm sure you have heard of this health promotion board promoting this healthy plate concept. So this healthy plate concept as displayed here, half a plate is your vegetables, which is 2 serving. And then quarter plate, which is your carbohydrate, is 1 serving. This carbohydrate can be either your rice, your noodles, bread, biscuit, or even potatoes. Anything that is starchy. And another quarter of the plate, you can put it for your protein, like your meat, your chicken, your fish, or even egg and tofu. So this is considered a balanced meal, and we use this healthy plate concept to guide through our every meal decisions. Besides that, we always choose water whenever possible. And if you were to go to any hawker center or supermarket shelves, you'll be able to see this healthy logo displayed on certain products or items. But this doesn't mean that everything is suitable for people with diabetes. Let's take fruit juice for example. A lot of fruit juices packaging label as lower in sugar or no added sugar. But does this mean that this is suitable for diabetes people? Not necessarily. This is because fruit juice contain a high amount of fructose. If you turn to the nutritional label at the back of the packaging, you'll be able to see that the carbohydrate contents are actually pretty high. And if you're interested and you're keen to find out more about how to read your nutritional label and how to manage your diet, this is tailored individual. You can book an appointment with your dietitian to discuss further about your meal pattern. And the survey shows that we make decisions approximately 35,000 decisions in a day from the time that we wake up all the way until the time that we sleep. So one common decision that we need to make every day would be what to eat. And what to eat for breakfast, what to eat for your lunch, your dinner, or even tea break, or maybe supper. So let's look here on the screen. Would you choose these fried noodles as your breakfast together with maybe fried chicken wing and one egg for your breakfast? Or would you choose chwee kueh for your breakfast? Or maybe some asking me that, do you have any other choices besides this? Yes, of course there is. You can also choose sandwiches. And you compare left and right. Which one do you think is a better choice, whether or not you have diabetes? I believe that you will agree with me that the sandwich would be a better choice. This is because if you recall the healthy plate concept, the sandwich contains carbohydrate, which is the 2 pieces of bread. This 2 pieces of bread is equivalent to half bowl of rice. And it contains a lot of greens as well, vegetables, and it has meat on it. So it is resembling the healthy plate concept. Does this mean that you cannot enjoy your fried bee hoon anymore? No, it's not true. You can actually have this fried bee hoon, but you have to make some modification to it. For example, you reduce the portion of the bee hoon and then you add 2 more vegetable servings to it. So now does it look more like a healthy plate? Yeah, so you can do all these little changes from what you are learning here today. Moving on, what about lunch and dinner? Would you choose char kway teow for your lunch or dinner? Or do you think that maybe I'll just eat bread? Since I say sandwich is good, right? Yeah. What about cai peng or your nasi padang? Will this be a better choice? Yeah. So looking at this, the char kway teow here is that it is mainly carbohydrate. It doesn't have enough vegetables to eat as well. On top of that, the oil content is pretty high. So this one will spike our glucose level and also our glucose level is taking longer time to come down. So it doesn't resemble healthy plate concept. You might be thinking, I heard that people telling me rice is bad for diabetes. So why not I just take bread? Bread and rice both are carbohydrate. But if you are to take the bread alone only, you don't get any fiber, vitamins from the vegetables, and you don't have enough protein to eat as well. So if you would like to have bread for your meals, make it into a sandwich. Have some other side dishes as well. And why do we ask our patients to choose cai peng is that you get to choose what goes into your plate and you get to decide the amount as well. You can of course choose 3 vegetables if you want to, but remember that you still need your protein intake. And the general rule of thumb here that I would like to highlight is that if you were to eat out or eat at home, try to go without gravy because the gravy contains certain amount of glucose, certain amount of sugar, and it's also higher in fat content. If you are to cook, we advocate for a healthier cooking method. For example, you can use an air frying method, boiling, steaming, baking as well. If you want to enjoy your drinks or your dessert, go for no syrup or less sugar. Always choose soupy version of noodles because of the sauce. The sauce is higher in oil, and also they have some amount of higher amount of sodium, which is the salt level. Okay. Besides making wise decisions for our diet, we also need to look at active lifestyle. So the next acronym in the Beat Diabetes is that adopt an active lifestyle. Health Promotion Board recommends 150 minutes of moderate to high intensity of exercises per week. This includes both aerobic and resistance. And most of us have multiple roles and responsibilities to juggle in life. And as a parent, we would want the best for our kids. So why not lead by example and start them young? We can make it fun too. Bring them to a park, run around, jog together, or even play some sports together. If you would like to have group activities, you can join a Zumba group, or you can do it online as well. This will help to motivate you to exercise more. And in Singapore, the weather can be quite unpredictable, isn't it? So we can slot in also some pocket of time to do our exercises. For example, in the office after lunch, you can take 15-20 minutes to do some exercises, or even before bedtime. For myself, sometimes on busy day, I'll make sure that I'll exercise a little bit and in the evening after I put my daughter to sleep. I can watch even a movie and do some squats, some stationary jog to get myself active. You can do this as well, but remember, if you haven't been exercising for a long time and you plan to commence any new form of exercises, always do consult your healthcare provider first for safety reasons. And exercise is free for all. You can do this anywhere and anytime. Okay? So the next on the list would be to take control. So how do we take control of our own health? We can do regular monitoring of our own weight. So most of you would have a weighing scale at home, I believe. You can monitor your own weight because being overweight is one of the risk factors in developing diabetes. You can go for your regular checkup, get your blood test done, know your report where you are at, then we move towards your goal. If your blood pressure, if you have blood pressure machine, you can always monitor either in the morning or night to make sure that your blood pressure is in the good range. We usually target below 140/90, but the target is also individualized. Do check with your doctors as well. When we have the knowledge and skills to do self-monitoring, we'll be able to know where we are at right now, how well we are doing, and how much more effort do I need to put in to help manage our diabetes. And some people with diabetes, they have a higher risk of developing this complication called hypoglycemia, which means low blood sugars. They may be feeling hungry, sweaty, feeling tired or weak. Some of them may complain of symptoms like trembling or shaking, feeling anxious, irritable. Some may have blurry visions. Some of my patients do report that they feel a bit confused or even fast heartbeat. When they have all these symptoms, we will advise them, the first thing to do is to check their sugars. And then if the sugars is low, below less than 4, we will advise them to treat it immediately by taking sugary drinks. For further details, you can discuss with your healthcare provider how to manage hypoglycemia. And on sick day, you are feeling extremely unwell, for example, severe diarrhea, dehydrated, nausea, vomiting, or even high fever, do seek immediate medical attention. Okay. And we may, just now I mentioned that we need to monitor our blood glucose. So to share with you, we usually get our patients to purchase any form of glucometer for them to do regular monitoring, either before meal or after meal. And the targets is shown as the traffic light chart earlier. Some of the patients may be asking, what if I don't like finger prick? Here, we can have continuous glucose monitoring. This one will help us to understand whether your body is responding well to the food or the medications or exercises that you are doing. Another area that you can take control of is food care. So you can practice all these simple habits that I'm sharing with you, check your feet daily, and also to wash them clean with soap and water that dry. Make sure between the toes is dry well so that it doesn't invite fungal infection. Then you can also apply moisturizer to prevent cracked heels as well. You can trim your nails horizontally and also file it off the edges. Wear comfortable shoes and change your socks regularly for hygiene purposes. If you're being prescribed certain medications, do remember to take your medications regularly and at the correct timing as instructed. And also to eat regular meals to prevent low blood glucose attack. If you're on insulin, do check the expiry date and use it accordingly. If you feel extremely unwell, please consult a doctor. Not forgetting to stop smoking because smoking worsens the narrowing of the blood vessels and it reduces the blood flow to many organs, which can lead to serious complication. If you find that it's very challenging to stop smoking, you can always consult your pharmacist to get help. And lastly, to limit your alcohol intake because alcohol interferes with the meal plan and also the blood glucose control. For male, we generally advocate do not exceed 2 servings of alcohol per day, and for ladies, only 1 serving a day would be enough. So there's quite a bit of information today. Let's do a recap. There are few common types of diabetes, and today we are focusing on type 2 diabetes. So in order to manage this condition, we use the acronym BEAT. So to be aware, do your health screening, know where you're at right now, and then to eat right, always choose healthy plate concept and choose water. Look out for the healthy logo, the pyramid. And to adopt an active lifestyle, we recommend 150 minutes of moderate to high intensity of exercises, which includes aerobic and also resistant exercises. And to take control of your own health by regular monitoring and good food care. Not forgetting to stop smoking and to limit your alcohol intake. Now, I have some frequently asked questions by my patients. Maybe I'll just share with you. Meanwhile, if you have any questions, you can now post in the Facebook group chat and I'll answer them as much as I can if the time permits. Number 1, I get this very frequent from our newly diagnosed diabetes group. They will tell me that, nurse, I feel very well. I don't think I have diabetes, but my doctor sent me here for consultation. So to explain this, actually many people, they don't have symptoms at the beginning stage. And if they wait until the symptoms develop, usually it's at the later stage already. For example, some will discover that they have diabetes when they are admitted for other conditions like infection, or they need to go for certain surgery like cataract surgery, and then they do their health check. The doctor will do some routine blood tests and found out that the blood glucose level actually on the higher side. This is when they know that, hey, actually I have diabetes. Doesn't mean that you don't have symptoms, then you don't have diabetes. While some others, they may have the more common symptoms like unexplained weight loss, or even they feel very thirsty all the time, frequent urination, or even they feel hungry even after eating. So these are some of the common symptoms that we know. Other questions that I get asked a lot is that, can diabetes be cured? I'm sure many of you have been thinking as well. So diabetes does not go away like common cold. You will have it for the rest of your life, but it can go into remission through certain procedure like bariatric surgery. And if diabetes is managed well with good lifestyle changes, medications, good support, and also frequent monitoring, you can prevent complications. And for those who belong to the pre-diabetes group, if you practice intensive lifestyle modification and you're very careful with your food, and this condition can actually be reversed. So it's actually a good news. Next, can I still eat my favorite fruits although I have diabetes? So in Singapore, I know everybody loves to eat. So I also do get this question very frequently. And some people think that fruits are not good for people with diabetes as they contain a lot of sugar. However, you can still have them if you use portion control so that you do not consume too much fructose in one meal. Aim to have 2 servings of fruits per day because fruits are high in fiber, low in fat, and full of vitamins and minerals. And what do I mean by portion control and how do I measure each serving? Here, I have some examples for you. For example, durian. Oh, of course, durian you can eat, but we do portion control as well. For 2 seeds of durian is equivalent to 1 serving. So 2 servings a day doesn't mean that you can eat 4 seeds at one go. We usually recommend to separate the servings. And if for grapes, it's about 8 pieces of bigger grapes and 13 pieces for smaller, either or. If you are taking dates, especially for those who are taking dates for Ramadan purposes, we advise at most you take 2 pieces at once. And if you were to buy cut fruits outside at the hawker store, you can have 1 slice of papaya, or even you buy banana, get the smaller size, that is a 1 serving. And since I say that fruits is good for you, do you think you can take fruit juice? Okay, so try to think how do you make 1 fruit juice? To make 1 glass of fruit juice, you will need to use at least 2 to 3 fruits. And that will be too much fructose in 1 glass. And drinking juice also means that you miss out on the benefits of fiber. That's why it is always better to eat the fruit as it is. Fruit juice we usually reserve for hypoglycemia attack, which is the low blood sugar events. We need fast-acting sugars, and fruit juice is one of them. That's why on day-to-day basis, we prefer our patients to take fruits as a whole rather than fruit juices. You may be thinking, my doctor will check the sugar for me. Why are you asking me to check my sugars? Going to the doctor for a visit only allow you to know your sugar at that point of time. What about the rest of the day? Who will monitor the sugar for you? We ourselves will have to take the responsibility and ownership to start monitoring. And to have the better understanding of your own sugar reading, we advise to check regularly, especially when you are on insulin. You can follow the guide earlier that I showed, the pre-meals glucose level and also the 2 hours post-meal glucose level. Okay, so I do have some questions coming in already. And if you do have any other questions, do type it out. Okay, so I have this audience here asking, is pre-diabetes considered as diabetes? So as I mentioned in my earlier slides, pre-diabetes is when the blood glucose level is on the highest, slightly elevated, but it's not high enough to be considered as type 2 diabetes. And this condition can be reversible if you get proper advice in doing your exercises and also managing your food, as well as how to cope with stress. All this plays an important role in diabetes management as well. I hope that answers your question. And moving on, I have another audience here asking, what is included in the health screening? So as I mentioned as well, health screening, there's a lot of packages. Depending on what suits you, you can always ask the clinic who is offering you the health screening packages, which one is suitable for you. But today we are looking particularly for diabetes screening. If you can also get your cholesterol check and also your blood pressure check, because these 3 things are closely related. If you are of certain age, they may also ask you to go for eye checks and things like that. Okay. How frequent should a senior go for health screening? Okay, so if you are 40 years old and above and your diabetes level, as in your blood glucose level is found to be normal, we advise for a repeated health screening for diabetes every 3 yearly if you're 40 years old and above. Okay. And if your results found to be slightly high, usually the doctor will ask you to come back for routine follow-up, or maybe a nurse follow-up to see how you are doing, just to make sure that you are on the right track and you don't, the condition doesn't worsen too quickly. Okay, next question. Are bitter gourd, lady's finger, or other supplements good for diabetes? So to answer this question, actually it's possible because some of these plants have some compound that acts as a sugar blocker. You can take them as a food, but not as dietary supplement or a substitute to your diabetes medication. Always check with your healthcare provider before starting any form of supplements, and also to do your regular monitoring of blood glucose to see what is the effect as well. Because some herbs and some supplements may counteract the effect of the medications that the doctor is giving you, or it may cause harm to our kidneys if, let's say, the kidney is not doing very well already. So just be very careful and very mindful if you are starting any supplements. Okay, we have another question here. Does starting insulin means that a person is in a bad state? So it's not necessary that if you're on insulin means that your condition is very bad. It's more likely to provide the correct treatment to the correct condition. For example, for type 1 diabetes patient, they are on insulin therapy since at a younger age. It doesn't mean that they are in a bad state. It's just that we are prescribing the right treatment for the right cause. And sometimes insulin can be started for people with type 2 diabetes. If the blood glucose is found to be very high, this one will be able to help your pancreas to take a break, take a rest while the body recovers. So this may be an interim therapy as well. Okay, I hope that answers the question. And I have another question here. Once a person starts insulin, does it mean this is for long term or forever? Okay, so to answer this question, also not necessary. Some patients may be on insulin lifelong, but some patients may just be using insulin for a short-term period. If they do their routine screening and found that their glucose, their diabetes level is well managed, well controlled, we may consider to remove the insulin at this point of time as well. And if, let's say, the diabetes is not well controlled, we may adjust the insulin and maybe explore some other forms of treatment to help manage the diabetes so that you don't develop any serious complications. Okay, next question. Can you go walking during the 2 hours during OGTT? So for OGTT tests, we don't recommend any activities. This is to get a more accurate results. So when you are undergoing OGTT, after you've drank the orange juice, I mean, not really orange juice, but the orange color drink that the nurse provided you with, you are advised to just sit there and wait for the time to come for them to take another blood test. This one is to see how our body responds without other influences like our exercises or activities. You're also not supposed to drink plenty of water. You're also not supposed to eat other food as well. Okay, so people with diabetes can go blind, need dialysis, and get amputations. Not necessary as well. This all boils down to how well you can manage your diabetes during this period of time. It is possible if to get an amputation if the wound is not healing very well, the blood flow is not good, and is infected. You can always reduce all these chances of developing complications if you control your diabetes well, and also, of course, your blood pressure, and at the same time, your cholesterol level. Our advice is to always keep an active lifestyle, maintain ideal body weight, and of course to stop smoking. We do have another questions here from our audience. Can diabetes lead to heart attack? Sometimes the patient does not even know that they have diabetes. Yes, you are right. Many of our patients do not know that they have diabetes until it's at a late stage. This is why I've been emphasizing, do get your health screening done regularly so that we can pick up early if you have a chance of getting diabetes. And heart attack, as I mentioned earlier, 50% of the heart attack victims actually having diabetes as well. This is because remember that one of the complications, the diabetes condition actually attacks the blood vessels, and our heart is full of blood vessels, big and small. So when our blood vessels is affected, then the heart is affected. So eventually, this person actually have the risk of getting heart attack if it's coupled by other conditions like high blood pressure, even high cholesterol level. The risk of getting heart attack is even much higher. Okay, and we do have one more question here. For a pre-diabetic, is it advisable to skip a meal a day to speed up weight loss? Okay, so for nutritional wise, we will always do a holistic assessment first before we advise for any drastic changes. Of course, we advise for regular meal, but it also we also see what's the intention of making dietary changes. Our dietitian will be able to tell where is your BMI. If your BMI is normal, then you can still have your regular meals. If your intention is for weight loss and you're not on any form of high-risk medication, you may possibly skip a meal, okay? But it doesn't, then we also find that our patients, if they were to skip a meal, they tend to have a larger meal for their 2 meals. So this is actually worse than having 3 meals, because at one go you have a very, very big meal to compensate, and then the body is trying to catch up with the sugar spike, so it has to work overtime. Okay, for further advice, we need to have set up a consultation with your dietitian. Then they can measure what's your nutritional intake and what is the food that you are taking, is your protein intake enough, and all these things. Then we can tailor the meal plan for you. Okay, I hope that answers your question. And oh yes, we do have some questions coming in. What is the difference between type 1 and type 2 diabetes? Okay, it's a very good question. A lot of patients would say that, oh, my doctor only tell me that I have diabetes, but I don't understand which type of diabetes or which category do I belong to. So to put it in a simple terms, type 1 diabetes is when the pancreas is no longer able to produce insulin at all due to various reasons, either genetics or some virus infection or other things. Then their body will have high sugars all the time because there is no insulin to unlock the gateway to the cells, so the glucose will continuously stay in the bloodstream. So this group of patients, they would need long-term insulin therapy. They cannot stop their insulin. And while type 2 diabetes is that there are two main causes. One is either their body is resistant to the insulin that they have, or the insulin or the pancreas doesn't produce enough insulin to cope with the spike of the sugar. So it means the pancreas is still working, just that maybe it's exhausted, cannot produce enough, wear and tear, or even the insulin that has been produced doesn't work very well. Okay. Okay, next question. Is there any early symptom for diabetes? Well, there's not particularly any early symptoms. Like I mentioned, diabetes is a silent disease, a lot of them would not be able to pick up their diabetes if they do not go for health screening. And when they have the onset of symptoms, sometimes it's very subtle, like, oh, I just feel hungry. They think it's normal, or hungry, then I eat. And they don't think that there's anything wrong, so they don't go for health screening. And by the time it developed into a later stage of diabetes, they may already have some form of infection, ongoing unhealed wounds, or even some has having persistent weight loss, like 5 kg, 8 kg in the past 2-3 months. You'll be thinking weight loss is good, but no, it's not. Because if this unexplained weight loss, unintentional weight loss happens, which means that the body is using other source as energy instead of the glucose. When this happens, it can go into a serious situation, a serious health conditions, which we call DKA, which requires hospitalization. So, do get your health screening done early, and we are coming to the end of the year. So if you think that get your health screening done, you can either do this year or early next year to start the year right. Okay, so I think there's no more questions from our audience. I will end my talk today. I hope that you have picked up one tips or two to help you make some changes. And if you find our talk useful, do like and share the video with your friends and family to help them pick up these useful tips at their own pace and own convenience. And to learn more about diabetes and other NSA courses by Admiralty Medical Center, you can contact Ms. Chitra at 9675-7011, or you can email her at sonarno.chitra.d@ktph.com.sg, or visit our website at www.admiraltymedical.center.com.sg/events/events-list.aspx. Please call 6478-5029 or visit www.nsa.org.sg to explore the many learning opportunities for seniors aged 50 and above. Do remember to like and share and follow the C3A Facebook page to be notified of new content in the future. Thank you very much for your active participation and also for your attention. Have a very good evening, everybody. Bye-bye.